Hello, everyone, and welcome to Alia and Co., the podcast where we talk about some pretty complex things and we make them simple. I am your host, Alia Kizilbash, and today our topic is feeling seen. And I think I'm going to start this with a story. There was a young guy in South Africa that had some respiratory issues, and he went to the hospital, and he was in the ICU, not doing so well. There was a nurse that was attending to him, and the nurse was kind of his age, right? And so she was like, let me sign off because I'm not going to be here this weekend. Let me introduce you to this other nurse that's going to take my shifts, and then I'll be back on Monday. So what happens is she goes away and this young guy starts having some issues and he crashes really bad. And so bad, in fact, that he has this near-death experience. And in the experience, he actually sees this nurse that went away for the weekend, and she's surprised to see him. And she's like, "What are you doing here?" And he's just like, "Well, I'm here." And she's like, no, you need to go back to your body. You should not be here. But before you go, you need to tell my parents that I'm sorry that I crashed the car. And so he's just like, huh, what? Whatever. He wakes up and he's like, I need to share this information. So he tells the nurse that is there on staff that, listen, I had this experience and I need to, this is what I saw. And she's just like, you know what? Just focus on feeling better. This is just nothing. It's nothing, right? Turns out that the nurse that was on vacation or wherever she went, she went on vacation. She went for her 21st birthday. She goes on vacation and her parents had just bought her a car and she crashed it into a telephone pole and she dies immediately, instantly. Now, when it comes to this guy who is coming back from this experience and telling people things that he's seen that he really identifies with, he's not feeling seen if somebody's just dismissing it, And I know that this is like a super aggressive example. Like it's out there, it's an outlier. But I think that we also experience this in our daily lives, just even as a child. Perhaps maybe you might have been dismissed as a child. You might have seen something and you told an adult and they're like, no, that's not the way it happens. Or even like in a boardroom where you might say something, have an idea, say it out loud, and then somebody else has the idea and they get all the credit. Like, oh my gosh, that's such a great idea. Or maybe you are that friend that is always texting and checking up on everybody that is in your vicinity, and no one is doing that to you. And I think that we're always experiencing some format of feeling unseen. And so today we have just the best guest to let us know and talk about this concept of feeling unseen. And so welcome, Samiya Hashmi, Dr. Samiya Hashmi.
Hi.
She is a physician who is specializing in functional and integrative medicine, board certified in internal medicine, and also specializing in women's health. I'm not sure if I said everything, but
You said it perfectly.
okay, wonderful.
Yes.
We're really excited to have you. And
Excited to be here.
yeah, and I'm going to start I think just with the basics is what is functional medicine and integrative medicine? I think that these are just words that we hear, but I think that has a lot to do in terms of kind of like the example that I gave.
So, integrated medicine is a type of medicine overall, and underneath the branches are functional medicine and lifestyle medicine. So, it's a general term for holistic medicine. It's a field in medicine where conventional medicine is internal medicine, family medicine, pediatrics, kind of when you see your primary care doctor. So functional medicine is a stem of integrative medicine.
Okay. And so they're it's a STEM. And I just want to peel back the layers because I don't think that I'm the most intelligent person when it comes to medicine. So I feel as though maybe to me, I would understand it if you explain it to me at a third grade level.
Sure. So there's two different types of medicine that we go and see the doctor. So there's conventional medicine where you go and you get your checkup from your primary care physician And that is internal medicine. They go to medical school for 3 or 4 years, and then they go residency. That is the traditional route.
Okay.
And that is conventional medicine. Pharmaceutical medications, when you do for your checkups, when you get admitted to the hospital in case anything happened.
Okay.
Integrative medicine basically is a holistic approach to health. It does not use pharmaceutical medications. They focus more on lifestyle, supplementation, herbal remedies, more like mindfulness and mindset. So it's that idea.
Okay.
Yeah.
So it's like your environment. It's basically all of the things that you're not doing, that you are doing when that has nothing to do with whatever's on your chart.
Exactly.
So like your lab work and whatnot can be
Exactly.
what kind of medicine?
Conventional
medicine.
Yes.
Whereas functional medicine would be, you might have taken a supplement that might have made you a little bit angry that day. Or been around somebody who was probably pissing you off just a little bit, stressing you out, your job, or your kids kind of started misbehaving. Maybe somebody's somebody's sick, they have a cold. So literally everything that is surrounding.
Right. So the way to kind of look at it is that functional medicine is about your cellular makeup.
Okay.
Basically your tissues, your cells, your muscles, what makes up you biologically.
Okay.
And so that is a form of integrated medicine. And lifestyle medicine is about movement. Mm-hmm. How do you get up during the day? Do you get up with a positive mindset? Mm-hmm. Do you exercise? What is your nutrition? Mm-hmm. The people you're around? Mm-hmm. All of those things matter overall in health. So that is all like a holistic approach.
Yeah.
Yeah.
So do you think that sometimes when somebody comes into the doctor's office, and I know that you were mentioning to me that you have like you're an you're a hospitalist also,
Yes.
internal medicine doctor. Do you see time and time again in these very like conventional, traditional, allopathic medicine sort of spaces that some patient might come in and not really know what is happening, and men and women. Women, I think a little bit more because, we have all of these like, cycles and hormones and changes. And I don't know how to lose weight anymore. All of this. Like, I feel like this is such a massive concern. But then also it's like, why am I a bitch? What's happening?
I mean, I never thought I was a bitch before, but I know I'm a bitch now.
It's like, why can't I stop, right?
Like it's biology.
I know, exactly. That's exactly it.
Yes.
So do you feel like sometimes you might have women that come in, and even men that like feel like, wait, I'm complaining, I'm asking, I'm addressing my issues, I'm speaking to my physician, but they're not seeing me for what is actually going on, because they're just telling me, that's nothing, that's just, that just happens with age. And it's like, what? But I don't want to suffer.
That's exactly what I see in my office. And I think you said it beautifully. Mm-hmm. They don't feel seen.
Yeah.
They don't feel seen by their primary care doctor. They don't feel seen wherever they go. And they feel it in their gut that there is something wrong. Mm-hmm. And that's why they come to me to get answers. Mm-hmm. And they said, listen, I know my labs are normal. Mm-hmm. Everything looks normal, but I don't feel normal. I don't feel like myself like I used to in my 20s and 30s. And it's just brushed off as, well, you're just getting older.
Yeah.
So that is a definite concern why my patients come and see me, because I look beyond symptoms. Mm-hmm. I look beyond the Band-Aid, so to speak. Mm-hmm. I look beyond and figure out the root cause of why you're feeling this way. And it's also to actually have my patients finally feel seen.
Yeah.
That's really what it is. And for my patients to feel like they can have a doctor that understands how they're feeling and to honestly validate their feelings. Mm-hmm. Because your feelings, your intuition will never lie to you.
Right. And I love that you said that, because I think over time, perhaps maybe when you were younger, we're just experiencing life in its newness. Yes. I just remember when I was in high school the first time, I went to 7-Eleven and hung out with, like that was like,
Yeah.
that was really fun, right?
Yeah.
Like, I mean, I
Yeah.
have kids that drive now. And so,
That's
it's
amazing.
like,
Wow.
what I'm saying is like, they'll get in the car and be like, "Well, let's go somewhere. Let's go for a drive." I'm like, the last thing I want to do is get in a car and sit in traffic. Like that is the last thing.
Yes,
But
I
they're
know.
like, are blasting their music. They're like,
Yep.
and there's like a certain vigor to life that they have.
Yes.
Which I think that to some degree, it just becomes like something that is like, okay, well, this is life. I'm so excited by these new experiences. They become like these baby adults, right?
Yes.
But the more you start to experience things, right?
Mm-hmm.
The more experiences you have in life, the more it becomes kind of mundane.
I was just going to think that and say that.
Yeah.
It becomes mundane.
Right.
Routine.
Right, routine,
Mm-hmm.
which actually leaves a lot of room for then like understanding that there's something a little bit more and it's missing.
Right.
I could feel better.
Right.
Because I've had many vantage points,
Right.
And so like I would love to hear walking through like you just starting in internal medicine and then realizing that there was a need for a more like kind of like all encompassing kind of approach. Like what was like your aha moment?
I think my aha moment was definitely during COVID. So, as an internal medicine physician, as a hospitalist, honestly, working in the ICU and seeing the same different type of patients over and over again, dying from cancer, heart disease, diabetes, and basically what you said, just doing the mundane crap every single day.
Right.
Okay, going into work, I'm going to prescribe these medications. This is what's going to happen. This is how it's going to be. And I really just felt I'm just really sustaining life. And so my aha moment was when COVID happened, then basically the whole world shut down.
Right.
And we were on the front line, me and my whole team at the hospital, and patients were dying from underlying chronic disease. And I just felt at that moment, there has to be more. There has to be more I can do for my patients than just to allow them to progress in this mundane life and just give up. Give up that, okay, there's no hope for me. Nobody has answers for me. I'm feeling these symptoms. I'm feeling this in my body in my 40s and 50s, and there's no hope. My doctors don't even know. So I'm just going to die like everybody else, eating the bad food, not exercising enough, but I don't even know where to start. And the main problem is that a lot of patients, they want to do good for themselves. They want to eat better. They want to exercise. They want to do it, but they don't have any guidance. So when you live this mundane life, well, I'm just going to do what everyone wants me to do, and I'm just going to die like how everybody unfortunately dies. And, seeing that over and over again as a hospitalist. And then when COVID hit and when I saw more patients die because they had underlying chronic disease issues, I felt at that moment, tomorrow's not promised, and I can do better. There is a better way. So that's where I got certified into lifestyle medicine, which is all about movement. I got more certifications in, being like a health physician life coach. And then I was like, I can change patients' lives just by figuring out why are we feeling the way we are feeling. And we don't have to settle. We don't have to live this mundane life.
Right.
We can thrive in our 40s and 50s,
Oh, yeah.
men and women.
Right. Yeah.
Yeah.
And I think that it becomes a more humanistic approach, right?
Yes.
Because and one that involves empathy, because I think that we are all living an experience, right? We're all
Yeah.
humans here. We all get sick. We all care about the longevity of our lives. As me as a human being, I realize that maybe if I'm not at my happiest, perhaps there are other people out there that
Right.
are also unhappy.
Yes.
So do you feel like maybe there was a parallel that you drew between yourself seeing it in your own life and then also like seeing other people experiencing this the same way?
Absolutely. I really felt like there's more to life than just living how everybody else is living. And there's more to life in thriving, where I actually felt a lot in my patients, because I talked to in patients' families where they felt, okay, I've hit 40 and I feel like crap. Is that it? I've had my kids. I'm married. Is that it? But so my joints are going to hurt. I'm going to just gain weight no matter how many times I exercise. I'm just going to lose my libido. Really? I mean, let's just talk about that.
Yeah.
And that's it. That's my life. So when I started going into my 40s, I was like, no, that's not going to happen
Yeah.
to me.
No
I'm going to
thanks.
continue to thrive. So I, as a woman, I looked for ways where how can I thrive? What works for me? So I found out what works for me, making sure I worked out 3-4 times a week, making sure I meditated every morning, making sure I tried to surround myself with positive people, whether it was my family or my friends. And that allowed me to thrive. That allowed me to help others. And I felt like, why isn't everybody else doing this? Because they're not guided.
Right.
So I did start to see that in me. And I started to be like, no, there is a better way. We can continue to live amazing lives past the age of any age. And age is really nothing but a number.
Yeah, I agree. I totally agree. And I think that if there's a will, there's a way,
Yes.
right? I remember I turned 40 and I was like, I'll be damned if I turn 40 and I'm in the worst shape of my life. That was like the 2 months where I was like, oh my God, I'm gonna be terrible. I've never been in better shape my entire life.
Well, I can
was
definitely, I definitely, yes, I agree. And I bet it doesn't feel fantastic.
It does. I mean, I'm not
Right?
that was when I turned 40. I'm not 40 anymore,
Well,
so I'm not in the best shape.
Yes, you are. You're always like, always looking for
But what I'm saying is that, if there's a will, there is a way.
There is a way.
Right? And why should we feel like, because if you internally know that there is more to life and that there is no need to suffer,
Right.
then if there's a yearning that is there, then we need to, and I feel very sad that perhaps maybe somebody might just resign to feeling that this is my life and this is it. This is what it is, right?
I've had so many patients of mine reside to that life. And I think, going back to your point, as a hospitalist, I saw that time and time again in my patients, whether they were in their 60s, 50s, 70s, 80s, and also especially working in hospice. The biggest regret I have seen in all of my patients when they were dying on their deathbed, and I was their doctor and telling them they were going to die in 1 week, they said, I wish I would have lived life the way I wanted to.
Yeah.
I wish I would have spoken up more. I wish I would have surrounded myself with people that supported me. I wish that I took control of my health and I cared about what I ate. I wish, and this was the biggest theme for me, I wish I did not put anybody else's needs above my own. And that hit me.
That gives me chills.
Yeah. And that hit me.
Yeah.
And that to me is really about what wellness is. And I think you really brought it out in that fact. That is really my message, that it is not selfish to take care of yourself, to be in the best shape of your life, whatever age. Whether we are doing life with kids, without kids, whether we're married, whether we're divorced, whether we have sick parents, whatever we have, what's going on in our life, we cannot stop living. Because the minute we stop living, we're doing everybody around an injustice.
Right.
So that was my passion, to say that, listen, it is okay for you to speak up, to want more from your physicians,
Right.
and for everybody around you.
To stop living, just to kind of go, just
Yeah.
to lay it out, because I
Yes.
think that people need to know.
Yeah.
What does it mean to stop living?
What it means to stop living is when you stop being authentic, and when you stop having a voice, and when you stop speaking up for yourself, and when you stop listening to your intuition. That is basically stopping to live.
Yeah.
And when you purposely make yourself smaller to accommodate everybody else.
Right.
That's really stop living. And it could be so many examples in so many ways.
Yeah. Yeah. I think that that overarching theme that I'm hearing is your environment, and being able to understand what a toxic environment is.
Yes.
And I think that this word toxic, toxic.
It's
Oh,
like
she's
thrown around.
toxic.
It's thrown. It is so thrown around everywhere.
Like narcissists.
Oh, yeah.
Everybody's a narcissist.
Everyone's a narcissist. Everyone's toxic. I mean, it's very interesting. That's true. This is the year of narcissism and toxicity.
Oh, yes, absolutely, absolutely. I have a friend that was she's like a divorce attorney, and she was saying is like, it's that word I hear so much more. It's like my ex is a narcissist.
Oh, she's so toxic.
Exactly.
Yep.
It's just, over and over again. But there is some truth to it. So let's maybe, I don't know. I mean, everyone might in their mind have a specific kind of definition of what narcissism is.
Right.
But toxicity is more kind of just, it's like a blanketed sort of approach in the sense that anything that you're feeling that doesn't sit well, or something that inherently is bad for you,
right?
It might be something that could be toxic to you,
right?
And so, in terms of environment, because your environment is what presents that, I would love for you to elaborate more on a toxic environment.
So, I would love to do that, and especially from a functional medicine doctor's point of view, I don't think everyone realizes how much your environment affects your health. And what I'm really talking about is your gut health. So there have been a lot of studies that have proven that your bacteria in your gut listen to your thoughts.
Ooh.
Yeah. Yes, they listen to your thoughts.
Pizza.
Yeah. Oh, yeah, that gut is speaking that. But it's that certain bacteria that's craving that sugar, wanting you to have that pizza. And when you're around an environment that we call toxic, where you are feeling not heard, where you are feeling depressed, where you are feeling basically small, you're feeling this anxiety and you keep it inside, then that actually changes your gut microflora. And that causes symptoms like IBS, inflammatory bowel disease, all of these different gut issues, diverticulitis, celiac disease, autoimmune disease, all of these things are incorporated from our environment. First off, then comes the nutrition, because then what do you do when you feel depressed because you're around a toxic environment, or you feel anxious? What makes you feel better? Two things. Okay, I'm going to have that pizza, or I'm not going to eat anything. So what does that do? Well, you bring the processed food in, feeds on more of that bad bacteria. And then what also happens, if you don't eat, you bring malnutrition in. You don't feed your cells, and therefore your cells get depleted. Then what happens? Hormones get affected in a toxic environment. Hormones don't work properly. And then women wonder why, that they go into early perimenopause during times of stress. It all starts with the environment.
Interesting. So anything that you're putting in your body, so you're bringing it out from the environment, putting it inside your body certainly has an effect, right?
Yes.
So eating clean, making sure that you're staying away from foods that could potentially make you feel bad,
Basically,
mentally.
Yes.
Yeah. But outside of that, you were mentioning, so these are certain like illnesses that you could.
Yes.
So do you find that also, I would love for you to elaborate in terms of mental health, like what kind of effect that has on your mental health?
Well, it has a tremendous effect on your mental health, because the way I look at it, when you eat foods that don't love you back, that actually can wreak havoc on your gut. So this is how it affects mental health. When you eat certain processed foods, or you don't have proper nutrition, when you don't feed your cells properly of the proper vitamins and minerals it needs, what happens is you are not feeding your gut proper cofactors, nutrients that it needs to make certain neurotransmitters, such as serotonin, our feel-good hormone. 90% of that hormone that makes us happy and feel well is in our gut. 70% of our immune system is in our gut. So when we are around a toxic environment, and then our gut feels it and our bacteria hear it, and then we don't feel like eating, and our nutrition suffers, our exercise suffers, all these toxins build up. Therefore, the system in our gut and our whole body system does not work properly. So you don't make enough serotonin. You have a gut imbalance. You feel tired, fatigued all the time. Those are starts. Those are starting point of depression.
Yeah.
So biologically, the food you eat either will love you back or will not love you back.
Right. Interesting. So number one, external environment, food is certainly important. And I think that it's just like also a chain reaction, right?
Yes.
So very like kind of like, in terms of your illnesses or, whatever, as it manifests itself,
Yes.
but also as, a byproduct of that is the way that it affects your mental health.
Yes.
So, okay, so that's interesting. So what can you do to have better gut health? Like, what are the things that you should be doing?
Well, first and foremost, I think the most important thing you need to do, and this is one thing I always stress to my patients, and you will totally laugh, the number one thing you can do is that when you're tired, rest. That is number one thing I will say. Before nutrition, before exercise, rest, sleep, 7-8 hours a night. Rest when you're exhausted. Don't keep going this rush hustle lifestyle, like the go, go, go. That is the worst thing you can do for your gut. Allow your gut to recharge.
But do you think a lot of people don't know, like, what if you're like a stay-at-home mom and, you just have to keep going and you're tired and and you hate your kids. You're like,
yeah, like please. And so, and I do have a lot of those, and I have a lot of stay-at-home mom patients that come to me and tell me like, listen, doc, I don't have time to rest. I got to get up in the morning with the kids. Yeah. And this is what I tell them. You could spend 5-10 minutes out of your day deep breathing.
Right.
And just having 5-10 minutes to yourself in one room and just breathe.
Right.
That is a form of rest. So rest can mean sleep.
Okay.
Rest can mean 5-10 minutes. You're just staring out the window with a cup of coffee or tea, whatever and you just take that moment. And you would be surprised how many moms don't do that.
Because they're just, as soon as they get a minute, they're on Instagram. That's what happens.
And they're trying to see who else is doing what.
Exactly.
And
Yeah. And I think that it just becomes like kind of like this muscle memory. Instagram, or it could be whatever, TikTok or Reddit. Or
whatever's in nowadays. I have no idea.
Snap them.
Keep
a streak up,
Exactly.
But the thing is, though, you're right. Like, I think that maybe in our society, it's just such an immediate gratification. We think that the way to rest is, okay, now I get some time. I get to be on my phone, or I get to watch a movie, or I get to, I get to do the things that maybe I don't typically do. But realizing that maybe your body is also not built to be entertained 100% of the day.
It is not. You have to look at your body as any type of machine. Okay, so when you drive your car, it needs rest.
Right.
If you drove it 12, 14, 16 hours, it will be tired.
Yeah.
Same with you. And I think the most important thing is looking as your body and like your brain, like a computer, like it needs time to recharge.
Right.
So a few things I always tell my busy moms to do is take 5 minutes out of your day, practice deep breathing. Breathe in for 4 seconds, hold it for 4 seconds, exhale for 4 seconds. Do that 3 times. You're letting in oxygen, you're holding in oxygen into your cells so that increases blood flow to your cells, and then you're releasing the carbon dioxide, all the waste and toxins that do not belong there.
Right.
The second thing you can do, go for a walk, especially after eating. It helps with digestion. 5-10 minutes a day. Now it's getting nice outside in Chicago. Woo! No excuses. Yes, finally. 10 minutes out of your day.
Right.
Go for a walk. Third thing you can do is, what I always suggest is just honestly, just take a bath, read a book, journal. Let those thoughts out. Journaling, it is the most wonderful feeling ever, because you're just releasing all the hate, all that toxin, all that anxiety that is in you right now, because it's energy. It's dead energy. You need to release it.
Yeah.
So that is the best way. So these 3 simple things, maybe they would take like a half hour, 40 minutes in the day. We get 24 hours in the day. You can find time to do that. And you will start to feel so good and so rejuvenated. Did I mention the gym? Did I mention meal prepping? I did not. I mean, yes, those are great things to do. But starting from there, that's going to give you the energy to do everything else for yourself.
Right. Yeah, no, I love that. And those are actionable insights, which sometimes I think that maybe the awareness is not there, and a lot of people don't know what it means to be tired. They just keep going.
Yes.
So how would you advise tuning into yourself? Like you think you're tired. It's like, I've done all of these things. Am I tired? I could potentially just go and hang out with these people that I don't really want to hang out with, or this business meeting, or blah, blah. You know what I mean?
It's something I have to do.
So how do you become in tune and aware to when you are actually tired?
So I think, unfortunately, unfortunately, I think everyone starts to have like this aha moment because that's the only way we learn.
Right.
It'll get to the point where your body is going to eventually tell you in some signs and symptoms, some clues your body will start giving you when you will realize you are tired. And that's when patients come to me. Well, a couple of things happen. Weight gain starts to happen. Because when do we really start to pay attention? When it affects our physical beauty. Really, let's be honest here. Okay, why am I gaining weight? I work out. Like, why am I gaining weight? This is not supposed to happen. Why am I tired? Why does it take me longer to get up in the morning? These certain clues and signs, you will know you're exhausted. Why am I breaking out? All these different times, these are clues that your gut is in imbalance. Why am I bloated every time I eat? This never happened before. Do I have a food sensitivity? Why do I? So these are clues that your body's trying to tell you you are exhausted.
That's fascinating. And I know it's as simple as that, but actually I never thought of it that way. Like so these are really good clues. Actually, I really love that.
Yeah.
Yeah. So definitely that and I think so we've got the gut health. Understanding the level of exhaustion that you are putting out into the environment, and then the environment is just slapping you right back with it,
Right.
But are there other things that are also in your environment that might contribute to your overall wellness and your happiness, your health? Are there other things that you might include? Maybe is it like people?
Yes, the people that you hang out with definitely contributes to your wellness. When you are hang around certain people that don't add to your value, that definitely contributes to your happiness and your overall longevity. When you're not in alignment of a certain group of people, then you have to get out of that world, no matter how scary it is, to feel in alignment and to feel like, okay, I am in my truth.
I love that you said no matter how scary it is. I would love for you to elaborate on that, because I think that is I mean, I hear you say it and I feel it, you know, because I also hear it. But I think that maybe for somebody who maybe has not internalized that yet.
Yeah.
Because I think sometimes we get kind of on this hamster wheel of this is just the way it is.
Right.
This is how I'm supposed to be. This is how, if this family member says this, I'm just supposed to behave this way.
I'm supposed to just accept it.
And this is the way life is, and this is the expectation that is had of women, of men, of anybody. This is just the way that I suck it up, and we all do it, you know? But do you feel like there's a little bit more beyond that surface level?
Yes. So what happens when you just suck it up and you take in the toxicity, there's that word again. What happens actually biologically is that your sympathetic nervous system actually starts to go off. So I'm going to backtrack here biologically.
Sorry, say that again?
The sympathetic nervous system.
Before that, like you said, what starts to happen?
It starts to basically go up.
When
you're in a toxic environment where you take it in.
Yes, okay.
Where you basically take in someone's toxicity, or someone like, okay, I just have to suck it up, or I should just brush it off, or this is just the way it is, and I just need to keep going, and I know, and my needs don't matter. When you start ignoring your needs, your body is going to give you signals, well, you cannot ignore it. Because this is what I think patients and everybody in general don't realize, that the body keeps a score. Every time you ignore any signs or signals, it's just going to get worse. Because where does it go if you do not release it? So there is a biology to this. So we have two different types of nervous system in our body. We have the sympathetic nervous system and we have the parasympathetic nervous system. So the sympathetic nervous system is when we feel fear. When we feel adrenaline rush. Okay, we have to get the kids to school. We have to get this project done at our job. Or I'm angry and I'm upset and I have to keep going, and this is just how it is. So our bodies, they're not designed to always be in a sympathetic state. But that is our society. Constantly being in a sympathetic state, taking everybody's crap. Dealing with world life changes. No, we just need to keep doing it. We need to keep doing it. Where we never focus on our parasympathetic state, where it's like making room for who we are. And basically being unapologetic in who we are. And what does that mean? Not taking that crap, walking away from that situation. But then the fear comes in. where the sympathetic nervous acts and like, no, no, no. You remember, this is what's going to happen. These are the consequences. Well, it's really about, well, I need to be true in who I am.
Right. Can you give examples of, like, for example, perhaps maybe, is it culture? Is it the expectations that we have in our society from women, men even, but I think that more so women, because I think that specifically hormonally and all of the ways that we've had to, you have your cycle as a young person, then you go through pregnancy and nursing, and then perimenopause, menopause, and who knows what's it, then you die. I mean, there's just so many things that happen.
True. Women go through so many cycles in their life, so many medical and emotional changes in their life. That I 100% agree with you.
Do you think that maybe, when as we're going through all of these experiences, is there something that you would say that perhaps women can do to kind of be more present with themselves?
Yes. One thing I would definitely say for women, and just first of all, I feel women in general, so men go through their own changes in life as well. But yes, women, we go through puberty, and we all go through different ages in puberty. We go through 12, 13, some get their period at 16. We all go through different stages in life. When we go through pregnancy, our body goes through all these changes, this hormonal shifts. And yes, there are these expectations from girls, young girls, till they come teenagers, till they're young moms, and then when they're older women. So we go through these changes. What is expected of us is that we need to always be proper. We need to always say the right thing, and we need to always be on point.
Right.
And we need to take in what anybody says, and we should just let things go because that's ladylike.
Right. That's ladylike.
Yeah.
And that's funny because, yes, definitely from a femininity standpoint, but then also in many cultures, it's like, okay, let's squash it. Like, just at least from what I know of South Asian culture, is a matter of, and many extensions,
many
like
many cultures,
women in the workplace, or it could be, just any kind of environment where there are expectations from women to be a certain way.
Yes.
So is there a link between that suppression of what they think they need to be and the realization of maybe one day it's like, I realized that all of that was nonsense, and maybe I should have just been listening to myself. Like, I didn't feel like I wanted to. Like, sometimes I feel like they're so brainwashed. Maybe there's certain ways that maybe I might have felt it. Like, it's just societal, right? Like, we feel like we need to behave in a certain way always. And then maybe you don't even realize that there's another way to behave.
Well, it's that idea. We're so used to not being seen. That's really what that is.
Right.
And it ties so well into functional medicine for me. And that is where it holds dear to my heart. We're grown to not feel seen. So when we go see our primary care doctor, listen, I'm not feeling well. I don't care what my labs look like. I'm not feeling right. You're fine. It's just aging. Go take some Tylenol. And as far as the toxicity of all of this going on, well, that's just what expected of you. You just deal with it.
Right.
And that hurts your biology inside. Biologically, that's hurting you inside, because deep down inside, when you're around the culture of like the certain expectation of always having a certain expectation of a woman, we have to cook, clean. Also, if we are working moms, pay the bills. Also, raise the children perfectly. And also, take care of the man.
Right.
So all of these things, when that is put upon us biologically, it kills us inside. And then when our doctors don't hear us when we're having certain symptoms because they don't understand, that's even worse.
Yeah. And that's the thing is, though, I think that the nature of a lot of disease, and is it disease, right? It could be, it's definitely, it may be disease, but it's also, there's so many things surrounding medicine that is so complex that you feel like something's wrong, but you just don't even know where to even start with it.
Right.
And so like for somebody who's feeling that way, that might have, say, for example, gotten to the doctor, and just kind of like, no, this first guy, like, he's just making no sense, and nobody listens to me, and then they're hopeless. What would you say would be the next step for somebody like that?
Find another doctor. Number one, find a doctor that hears you. Find a doctor that understands that your symptoms are real. Find a doctor that validates you. And find a physician that will spend the time to understand your symptoms. Find a physician that will go beyond the basic blood work to really figure out what is going on. Because there are other types of blood work, especially as functional medicine physicians do, that your primary care doctors do not.
Right.
Now, I just want to say, I'm not here to bash our primary care physicians. A lot of them are my friends, and they are needed. For emergent cases, but it's just that there is a place for them, but there is a place for me.
Right.
So when a woman comes in the doctor's office and she's not getting the answers she wants, the best way is to be like, okay, I need to see a specialist, a functional medicine physician that can go beyond the basic blood work and figure out other testing that can figure out what could be really the root cause of my symptoms, because it's always more complex than anything.
So when a woman or a man
Yes.
that comes to you in your clinic, functional medicine, are there signs? What are the things that you see over and over again in women or men that might be burnt out, anxious, kind of like, there's certain frustrations. Are there certain symptoms that you see in these individuals over and over again?
I see a lot of fatigue symptoms that I see. I see a lot of like, doc, I've been to my primary, I've been to this doctor, I've been to that doctor, and no one can figure out what's going on with me, but I know something is wrong. They're very intuitive. My patients are very intuitive. I see that they've gained weight, they've lost weight, they've been on these yo-yo diets. There's no guidance of what to do next. And they're looking for guidance.
Yeah.
And they're looking for answers, and they just want a physician that can spend time with them to kind of almost navigate and be almost like a detective. Okay, what exactly is the root cause of why am I feeling tired, fatigued, burnt out? Okay, yeah, it's my job. Okay, yes, it's stress of life, but that's not really going to change.
Right.
I want answers.
Right.
That's what I want. They're looking for solutions. That is a common thing I see. Like, I just need answers. I need a physician to just listen.
Right.
Who has time to listen.
Yeah, because I think that it can be in some ways very transactional, and each physician is very unique and different. They bring their own personalities.
Yes.
Just because you went to one, maybe say, for example, internal medicine doctor that might have not addressed your needs, it does not mean that everyone is like that.
Exactly.
I've been to some excellent internal medicine doctors that just, things that I never even thought.
Yeah.
I was like, wow, you know.
Yeah.
Thank you,
Yes.
But I think that, like you said, perhaps maybe they're not really looking at also that added component of your real environment,
Right.
and what is affecting you, which actually does have a large, significant effect on the way that you live your life. So I love that. So now, I feel like perhaps, do you think that as you look at all of these different experiences and these different ranges of individuals that are coming in, do you also find that there's a certain kind of mental programming they have that doesn't allow for them to look out and say, hey, why was I thinking this way? Like maybe the toxic friends, right? So certain cultures are like, listen, just, it's okay,
Yes.
Your guest comes first,
Yes.
Like,
Yes.
Somebody,
Yes.
you know what I mean? Like,
Yes.
Do you see that often?
I do. I see that literally 99% of the time. I'm not even kidding.
Yeah.
I see this I see this like subtle idea, well, I need to do everything perfect. Well, it doesn't matter. No, I have to go to that party.
Yeah.
No, I have to just not say anything when my mom gets upset with me. Like, I can't voice my feelings. No, I have to put up with that with that toxic friend, and I have to just do these things because that's what expected of me.
Right.
I don't want to rock the boat, is what I see, and I see how that is so detrimental for their environment in the first place. And I honestly do tell them in my office, and this is what I say. I go, listen, I could throw every supplement at you. I can fix your hormones. I can even kill all the bad bacteria out of your gut. But if you do not deal with your environment and how you handle it and how you allow others to treat you, nothing is going to change.
Right. And I think that's very sad, though, is that the fact that some of these women and, certain individuals, maybe me included, some of them can be selfless,
Very, yeah.
And I think tradition and culture and just the expectations of women in general sometimes is the one that, is malleable and flexible and,
Yes.
and forgiving. But then there are people that are women that are not nice, and so.
And they're known as bitches.
Yeah, that's what
I'm just saying.
That's what they're called,
They're
guys.
called bitches. But it's so true. But then everyone admires those bitches.
Because the mean girl always wins, you think? Not really. To be honest, she's the saddest one of them all.
No,
but
it depends on. No, mean girls never win. That will, because mean girls, that's when they really need to come to me.
yeah, if you're a mean girl,
because they need to really change their biology.
yes, functional medicine.
Yes, they really need to change their biology, because it's all about their biology. It's all about how are they processing things. So no, mean girls don't win. But it's the women that say enough is enough. I'm not going to tolerate my environment being negative anymore. I'm going to make my environment positive. I'm only going to bring people in my life that uplift me and love me, because my bacteria will thank me. My parasympathetic nervous system will be up, and my sympathetic will be okay and in check. Now, that is what's key. And those types of women are empowered, and they feel more empowered by their environment, by their family, by their partner, by their friends. Now, when I say that's hard, because we're stuck in this environment or this play that we just have to appease everyone. We can't rock the boat. We have to keep the peace. Well, the peace is costing you here.
Yeah. And that's the thing is, though, to be able to recognize it, and even for those mean girls out there, it's they're also human beings, right?
They are.
And putting out negativity into the world in whatever format that's the case, typically that person is coming from a place of fear. It's not that they're the mean girl. They may be. Sometimes I think a lot of people think that the people that are putting out negativity are somehow feeling happy or joy. To be honest, sometimes they're the ones that are suffering even more than everybody else. So, anyway.
I find that very common in my practice. Like the ones that put out the most negativity have the most inflamed gut, have the most, like malnutrition ever. They're not speaking wellness. And they're actually not even just having fear, but they're lacking love in their lives.
Right. And not so much love externally from other people, but also just loving themselves, right?
Internal validation.
And I think that it starts specifically with your mental health,
Yes.
It takes your mental health to recognize that there are issues there to begin with, which in turn allow for you to go and seek treatment on a physical level. And so do you think that, in any interim period, right, whether you may be thinking that a certain thing is going to bring you joy, right? I think that a lot of us, maybe sometimes we think that, hey, if I have this achievement, everything is going to be perfect, But that is also seldom so, I think that we need to, number one, work on ourselves and understand that at the end of the day, we have been with us always. The only one that's been there that has ever had my back is me in everything that I've ever been through. So I think that more people need to recognize that about themselves. Do you think that might be kind of just that realization? How do people get to that? How can you get to that, to realize that, listen, I need to be nice to me, and that is how I'm going to help myself?
I think they get to the point when it's become a point of no return, when their gut is imbalanced, when they don't like how they look, they don't feel good about themselves inside and out, and they kind of get to that point, okay, clearly whatever I'm doing is not working. What is going on with me? And not everyone gets to that point, unfortunately, but the ones that do, the ones that really want to feel aligned, that's where they're like, okay, this is not working. I want to change my life. And I want to feel empowered and do this. And that is actually the patient that does come and see me, where their first thing they say to me is, Doc, I want to change my life. I don't like how I'm eating, how I'm sleeping. I don't like how I hate everybody, how I've put on so much weight. There is a better way. This is not me.
Right.
So they recognize that they feel trapped
Right,
in their body.
Yeah. And I think maybe perhaps that's also that cultural belief that is almost kind of slowly killing us, right?
It is.
Yeah.
It is. And the culture belief that I think all women suffer from, that we can't listen to that voice.
Right. Yeah, exactly.
We have to just keep going.
Right.
And it doesn't matter. We have to keep the boat afloat. We have to hold the fort. How many times have we felt that way? We got to hold the fort, because if we don't, the boat will fall.
Yeah.
Well, have you ever thought that if you keep holding the fort, eventually the pressure will make it fall?
Yeah. Yeah, that's true. That is true.
Yeah.
Or collapse.
Yeah, exactly. And so what do you do then?
Yeah. What do you do? But so that 100%. I love this. I it's fascinating because there is a lot to it. It can be nuanced, but the general theme of it is that put yourself first and
Yes.
be able to be more self-aware. A lot of it does come from the way that we've been raised.
Yes.
It's a generational thing.
It really is, yes.
Do you find that maybe there might be a way to kind of like break that generational, we're victims of victims type
Yes.
of mentality?
I do. There is a way to break that. And you don't have to do it in a very harsh way. It could just be subtle ways. Like, listen, it's about having this mindset. I need to take care of myself, do small things for my self-care in order to be able to be the best wife,
Right.
the best mom, the best daughter, the best sister, the best friend. And it's this mindset, it starts with this mindset that it is not selfish to love yourself, to take care of yourself in whatever small way it's necessary. Meaning, if I need to get a nanny in the mornings to help me with the kids, I don't need to feel guilty. I can sleep in for that extra half hour because when the kids come home, mommy's rested.
Right.
It's these little subtle things. It's the subtle thing of also in functional medicine. Well, listen, I don't need to accept that this is my life and I'm just going to get older and I have to accept it. I need to love myself enough. I need to find a physician that's going to hear me out and find out what's wrong with me. And that is loving myself so I can be more loving to others and to everyone.
Right.
It's about, I feel, women in all society just breaking that idea that you have to be selfless in order to be seen.
So is it trial by error to be able to find, because, maybe somebody doesn't live in the same town as you or nearby you. I'm going to her. But I'm just saying, is that is that the first step? It's I think functional medicine, there's definitely something to it in the sense that these are things that are guaranteed things that do affect your well-being.
Yes.
How would somebody find a functional medicine doctor?
Well, I think the good thing is that definitely there's a lot of awareness going on in functional medicine. So more patients are asking their physicians more about it. So a lot of times their primary care physicians can refer them to a functional medicine physician like myself. So I think we have that on our side.
Okay.
There's a lot of awareness, especially in the wellness industry. I believe, especially after COVID, there's more awareness of that. And also it's a lot of word of mouth. So that's where you can find a functional medicine physician. Also, the American Academy of Anti-Aging Medicine, a lot of the functional medicine doctors are registered there.
Okay.
So now times you can even Google in your area to come and we'll be registered there. So yeah, so it's very, and if you do Google my name, I'm very much there. You know where you can see me, and also we make it easy for you to make that first step.
Yeah.
Yeah.
So if there are maybe 3 things that a woman can do today outside of seeing a functional medicine doctor, because I think that should be, a goal, right? But if you're someone that is struggling today, what are 3 steps that you can take to start helping yourself?
Number 1, acknowledgement. Acknowledge that this is not working and trying to figure out a way how to do it and that not feeling guilty about it.
Right.
Number 2, taking the step of I'm going to eat better. I'm going to be more aware of what I put in my body. Just start there. Just cutting down processed foods and just incorporating more fruits and veggies. And you don't have to completely cut everything out cold turkey. I think we have this myth like, okay, we have to cut everything out and everything needs to be perfect. We don't need to be perfect. Number 3, start slowly with movement to help yourself. Go for walks after you eat 2-3 times a week. Just go for walks. Just little things like that, little movements here and there. Number 4, and I will add a 4th one, which is the most important one.
Okay.
Really be mentally aware of the people in your life, meaning who adds to your life and who doesn't in a happy way. Yeah.
Do you think that maybe there's a certain myth that we are all kind of like self-propagating, something that maybe women are believing that is something that is good for them, right for them, that actually isn't?
Yes, I do. And I think that comes with nutrition and the fact that, okay, we need to follow this fad diet. We need to follow that diet. And we have to be a certain weight. Otherwise, we're not healthy. We don't need to be any weight. Every woman's body is different. Every woman's biology is different. And men too. Nobody is the same.
Right.
And it's just about listening to your body. What works for you.
I think that's beautiful. Do you feel like there's one specific example in terms of a transition or a transformation that you might have had in terms of any of the clients that you see? And you don't have to disclose like the specifics, but are you seeing certain results with your clients?
I have definitely seen them. It's actually very beautiful to see when they first come into my office. So when they first come into my office, they're very anxious. They're very scared. They don't know what's going on, but they know something is wrong in their body. And they're looking for answers, and they're very lost. 3 months after seeing me, I can already see a shift. I see a shift, a transformation. Like they're more calm, they're more centered in who they are, and they know, okay, I'm feeling better. Like I feel like I am myself again. I feel like I'm in my body again, and I'm waking up again. And then 6 months down the road, I see even more transition. Okay, I'm changing my lifestyle. I'm eating better. I'm exercising more, and they become this strong person that they always knew that they were.
Right.
They just needed that guidance. And it's a very beautiful thing to see them transform and living a better life.
Yeah. I think that's the goal, right? Like, I think that sometimes we get stuck in living a certain kind of life that we think that this is it. But we are capable of making changes, and it is nice to be able to hear, and especially I learned a lot. Specifically, gut health was something that I didn't even realize how much of an impact that has.
Oh, yeah.
And just being aware of how little sleep and like, you're not sleeping, you might gain weight,
Yes.
So just being able to, and that was the first thing you mentioned, it's that important. Yeah. So you've been so helpful in helping us understand all of this. Definitely like these, I would say that's the new wave, right? I think that the way over time, and certainly we're not done learning things in the course of history and, and the future, right? There's going to be things that are going to be discovered all the time. And I love the fact that now we have this branch of medicine that is gaining traction in the sense that these things are all important. They affect us,
Yes.
So I want to thank you for, spelling it out and kind of being able to lay it out in such a concise way.
Thank you for having me.
So nice. Where can we reach you? How do we contact you? Any fun things that you're doing? And any advice that you can give anybody out there?
Well, what I want to say, the way you can contact me, so I am on Instagram, and you can find me on Instagram, Samiya Hashmi MD. I work at downtown Chicago at Green Circle Wellness, so you can always make an appointment there if you need to see me. I love what I do, and the best advice I can give you is that if you are not feeling like yourself, and if you feel there's a better way for your health, do not give up. Nothing is set in stone. You can change your life. And definitely, as a physician, I can definitely help you get there.
I love that. I love it. Thank you so much, Samiya, for being here.
Absolutely.
We have learned so much.
Thank you for having me.
Yes, life-changing. A lot of us are going to change our lives
after this. Absolutely. I look forward to it.
Amazing. All right.
Thank you.
Awesome.